Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Benjamin Crocker. He's Senior Vice President, Care Design and Innovation at IKS Health. And Andrew Dickmeyer, he's VP of Product at IKS Health. Welcome, guys.
Thanks for having us.
Thank you.
Excited to be here. This is part of our ongoing series of AI Medical Scribe, Ambient Clinical Voice companies. So excited to feature what you're doing at IKS Health. But before we go there, Ben, why don't you start us off? Tell us about yourself and IKS Health.
Great. I'm a practicing clinician, primary care physician for 23, 24 years. I hail from Boston. Mass General Hospital was my home for many decades. I was involved clinically with practice transformation, practice improvement. I was a medical director for a practice called the Ambulatory Practice of the Future, which was looking to leverage a new kind of team with both traditional and non-traditional team players, as well as leverage technology and platforms to deliver better care so that we could drive better care experiences for patients and for care team members as well. Awesome. And so for the last 3 years, I've been Senior Vice President of Care Design and Innovation at IKS. I help to lead and work with a design and development team on our clinical solutions at IKS Health.
Awesome. Andrew, how about yourself?
Well, I'm more of a startup guy. So most of my career has been in the startup world. Kind of my origins and product were more in retail technology. And I found I was working on really interesting technology, but not really caring too much about the impact of the outcomes of my work. So while day-to-day was very fun, I wanted to kind of switch into a mode where I was working on something that I felt like had an impact on people's lives. Nice. So I jumped into health tech, and I've worked for, this is my 4th company in health tech.
Wow, that's awesome.
And most of them have been startups, but now joining IKS, I kind of gotten the opportunity to join a company where there's a lot more capital, a lot more experience, and kind of power behind the brand and the name to get a lot bigger things done.
That's awesome. Well, Ben, tell us, what's the story behind IKS Health?
If you consider in aggregate all of the tasks of caring for a patient, so that means from a clinical standpoint, all of the things both upstream and downstream of the clinical visit, and then all of the tasks associated with both the care of patients in between visits, the revenue cycle management, we realize that the industry is just completely inundated with the work of care, such that we're drowning out the ability to care for patients and really just to deliver a positive and holistic experience for patients. In my line of work, I hear about this all the time. I experienced it as a clinician, where the work of care was even more time consuming than my ability just to be in care with patients. So when we consider all of that work, we ask ourselves at IKS Health, if it doesn't have to be done by a clinician or a care team member, or even a back office or front office team member or an administrator, then it shouldn't. If it doesn't have to be done in the clinic, then it shouldn't. If it doesn't have to be done in person, then it shouldn't. So we realize that with all of these chores of care, there's an opportunity to unburden care teams and organizations so that they can focus on the core of their work, which is really delivering excellent care, driving therapeutic relationships, and really building strategic moves within their communities as healthcare organizations.
Yeah. Well, I think that's why the AI Medical Scribe is so popular, is because of that administrative overhead that you talk about, and how do you get rid of that? So let's dive into your solution. Andrew, tell us, how does your solution compare to other AI Medical Scribes? Yeah. I've often listed off them all, but these days I just say go to Healthcare IT Today, click on the Ambient Clinical Voice one on the right sidebar. But anyway, how does it compare to the solutions out there?
Yeah, I think in some ways, the industry in this particular space is kind of a race to the bottom, so it's becoming increasingly commoditized. And so, we're right there in the mix, and it's a very similar product and process in the sense that we have ambient capture, we have a mobile app, we have a web portal, right? And you go from basically an audio recording to a clinical chart note. There's a number of things that, kind of happen very quickly with the technology these days. And so we're currently working on delivering things like multilingual care, multilingual support, increasing our specialty coverage, but next to other products, it's a very similar outcome, right? One of the things that we kind of take pride in here at IKS is particularly the quality of our clinical note, right? The accuracy of the content capture. We're lucky to have folks like Dr. Cocker that are part of our team and give us quick feedback and are actually physicians who can test, drive the product. So that kind of helps us have a quicker feedback loop to constantly improve the quality of our note. It also fits into our broader suite of documentation. So while we have Scribble Now as our pure GenAI solution, we also have different tiers in the Scribble product suite that offer increasing levels of human touch. And so I think that's one of our unique offerings here, is that most folks either offer traditional scribing, live scribing, virtual scribing, or pure GenAI, but we have a whole suite of products that kind of let you pick and choose as is best for your doctor.
Very interesting. So Ben, walk us through, what does the workflow look like for the clinician? Are they using a cell phone, a tablet, the desktop? Help us understand, what does that look like for a clinician that uses your product?
Yeah. Clinicians for Scribble Now, which is our pure generative AI product, Scribble Now, clinicians are using portable devices. That could be their smartphone, Android, or iOS supported.
Okay.
Could be a tablet. We are working on desktop, although our experience is that most clinicians these days really carry their mobile office on their phone.
Their phone's in their pocket one way or another.
That's right. And the clinical visit is dynamic, and so being able to move with your patient either through the care environment or around in the room is important for audio capture as well. So most of our clients really prefer that mobile device. So it's as simple as downloading the app. The app can pull a clinic schedule, or you can manually add patients yourself. You simply push record after a consent reminder that you're about to have a recorded conversation. You conduct the conversation and the encounter as you normally would as a clinician, and then within less than 2 minutes, usually about a minute and a half, you get a really nice note, which you can then retrieve on the portal.
That's awesome. And it's interesting, you talked about the suite of products that you have available, Andrew. How much of that's automated with technology, and talk about kind of the humans in the background. Sounds like there's one that's fully automated that you talked about, but maybe that you have some Scribe options as well. Talk about the different uses of technology versus humans.
Yeah, so I think, maybe I should just quickly say, our clinical documentation suite is the broadest in the market, right? And so the history of IKS includes, a lot of depth and a long history of delivering medical transcription, of delivering live scribing, right? And that live scribing could be virtual. We have asynchronous, fully manual traditional scribing, right? And so those are still things that we offer, right? Some folks prefer those today. Our Gen AI driven solutions, Scribble Now, is purely automated, right? So it's from the moment you record to the moment you get the note, it's all happening in a pure automated fashion. There's no human touch on that whatsoever. And then Scribble Swift and Pro are kind of increasing levels of touch that you can opt to purchase in order to have different levels of review on the note, right? And so Scribble Swift is a human scribe who's doing spot checks for things like hallucinations, spelling, right? Like making sure that the automatic speech recognition was accurately capturing words, formatting it in your organization or clinic's preferred templates.
Interesting. So it's using the Gen AI and just verifying
That's right. Yeah. So in Scribble Now, the pure Gen AI output is your output. In Scribble Swift and Pro, it becomes the draft note for the humans to start improving on, right? Okay. So the Scribble Swift is a human scribe. Scribble Pro is a clinician scribe. So we actually have a team of trained physicians in India, and they are empowered to review the note further and augment it with additional medical context, either from the transcript or from information in the EHR. And that product also includes coding. So once the clinician scribe is done, finalizes the note, then they can hand it off to our coding team, and we deliver the medical coding within 24 hours.
Yeah, you have the full spectrum.
That's right.
Talk about EHR integration. That's always an interesting question. How are you integrating with the EHR? Does it work with all the EHRs? Are you focusing on certain ones?
Yeah,
Maybe Andrew,
the $1 million question, obviously, these days. And so we recognize the strategic value of that. So we have a number of initiatives with all the biggest EHRs going on literally right now. It's very important for our company. IKS delivers our care enablement platform. So Scribble really fits into this broader suite broader platform vision that we have. And so you unlock increasing amounts of value as you kind of use more and more of the platform, right? Because we have more control over our ability to optimize those things with both our staff and our technology. And so the integration is strategic for the whole platform. While we're working towards that, because it's a little more complex than just saying, hey, I want to deliver a note. We have to integrate a whole lot more. There's a number of mechanisms, as I'm sure most folks in the industry know, that you can use to automate it. And so I think our goal is, in pursuit of deeper integration, we want to reduce the friction we kind of introduced in our implementation that we have today with our customers.
That's awesome. Let's talk about that implementation, and I'd love to hear from the doctor. Does the clinician have to change their way they're talking in the exam room to make your product work? The obvious ones over all the videos we've done in this series is they have to voice what they're thinking or what they're seeing. So far we haven't found an AI medical scribe that reads the brain yet, although I think they're working on that. But so talk about the clinician workflow and even the onboarding process. How do you train them and things like that?
Yeah, well, onboarding, I think one of the things that we've done for years now, even with our older forms of scribing, be it either transcription or with live scribes, is that we provide a lot of at-the-elbow support and training. Okay. We realize part of our goal is to meet clinicians where they are in their documentation experience. We know that some clinicians are very tech savvy and kind of pick up a tool and run with it. Sure. We know that other clinicians either are not and need a lot of technical support, or there may be some resistance to change of how this clinical document, which is the bread and butter, the fingerprint of their work, gets developed and placed in the chart. So we work with clinicians and care teams to understand what that process is. Not a lot has to change. I mean, as you said, there are some tips and tricks that we share about how to get the most out of generative AI. We have to realize that the clinical conversation is but part of what goes into the documentation. There's a lot of context that maybe is happening up here in a clinician's mind when they walk into a room with a clinician. They know a lot. The system knows a lot about them, but that's not always verbalized or captured in a way that generative AI can just step in and pick that up. So there are tips and tricks in the ways in which clinicians can relate to a lot of the inferential information that they're carrying. Sometimes just by calling out certain aspects of the visit, what we call signposting, which is really to say, hey, let's talk about your medicines for a minute, right? That actually enables generative AI to kind of think, they're talking about medicines, right?
That's interesting.
So, and even having clinicians get comfortable with the idea of either summarizing in front of their patient, sometimes after they see their patient and have said goodbye, they can summarize and verbalize things that they saw or are thinking about. All of that really enables generative AI to capture the best note possible.
That's awesome. Andrew, let's talk about accuracy. Everyone wants to know how accurate is the note, and I'd love to hear, how do you measure accuracy? How do you improve accuracy? Things around, how you're looking at making sure the note's as accurate as possible. Absolutely,
yeah. I think, I'm going to kind of take that in two different parts, two different tracks here. One is, I mentioned earlier, we're really proud of the quality of our content capture and the accuracy there. And part of that is due to the folks we have on the team, like Dr. Crocker, like I said. And so I kind of joke internally, I think if we can cross Dr. Crocker's bar, I think we're good, because he's pretty tough on us.
That's good.
And so,
that's good to have someone
but we get that feedback from folks who've just been, actually doing this for their entire career. And as I mentioned, we have a long history of delivering this manually as part of one of the products and services of the company. And so we're fortunate to have this kind of robust internal team that is already an expert in producing notes that allows us to measure quality both out the gate and as we iterate and change things moving forward, right? So we have an internal process to measure our quality. I also mentioned our suite of services here, and so as much as we're proud of the accuracy and the quality of the pure Gen AI solution, that's one of the things that you kind of get as you introduce additional levels of human touch that increase the accuracy. And nothing's perfect in Gen AI yet, right? There's shortcomings. And so one of the intents of that product is saying, hey, let's meet doctors where they're at. Let's not force a practice to make sure that everybody has to use all Gen AI or all human scribes. They can kind of each choose what best fits their workflows. So that's kind of how we're measuring quality internally and how we go about quality internally. But one of the other things that we recognized on this journey is that there is either aged or insufficient kind of frameworks for the industry to measure these things, right? There's not really like a great objective measurement that we all share, right? So if we go to every Gen AI company out here that's producing a clinical note, they're kind of going to give you their own version. And so one of the things that we're on the journey on internally right now, working with our team, is to leverage some existing academic frameworks, but develop a new framework. And we're hoping that we can be a leader in the industry to say, hey, look, we're all competitors, but we all need to have this objective measure of quality, because that's important. Ultimately, what we're working on is healthcare and human health, right? Patients. And so we want to kind of work with the rest of the industry to say, hey, we're going to deliver this so that we can all just make sure that we're measuring ourselves in a way that is holds us accountable to the quality of the product. And so that's another part of our journey that we really want to get to that I think I'm really, really excited about.
Yeah. That's really interesting. It'll be interesting to see how that evolves and how quickly that accuracy gets measured and things like that. So Ben, does this product work for every specialty? Are you focused on certain specialties or certain areas of medicine, or how are you approaching kind of the specialty question?
So across our entire suite of clinical documentation solutions, we cover a number of specialties. Obviously, a lot of internal medicine, family medicine, kind of general primary care, including pediatrics, but we also cover behavioral health, surgical specialties, medical subspecialties. I think as our Gen AI prompting and tailoring becomes even sharper, and as we can incorporate more templates and other tools into that mix, we're going to see a whole lot more kind of specificity to what we can deliver for our specialists.
Yeah, that's awesome. So is there anything else you could add before we wrap up?
Yeah, as we've put together and assembled this solution, this portfolio of solutions for clinical documentation, we realize right now the industry is often offering one point solution for many or all clinicians at an institution. I want you to imagine, even as a patient and as a physician, I imagine this, that what would it be like for the clinician to choose the right kind of clinical documentation solution based on the care that he or she is delivering and what that visit encounter really needs. If I'm seeing you for a sore throat and a cough, I might need very light, tech heavy, but very light assistance with that. Could be just pure Gen AI that drives that entire clinical documentation. If I'm coming to see you and you've just had a heart attack and you've come out of hospitalization and rehab, you've got 15 meds, but also the amount of information that we cover in that visit and the complexity of the medical decision making may be better supported by either a live Scribe or Scribble Pro, where you have a clinician scribe who's really reviewing that kind of documentation with you. So we believe that there's going to be a role in the future for us to have really care-driven opportunities to select what level of clinical documentation is appropriate for that visit.
And you can choose it at the note level. That's interesting.
At the visit level, that's right.
Yeah, and sort of, as we develop our products, we always want to make sure we're molding to our users, in this case our clinicians' workflows. We don't want to force them to adapt our workflows wherever we can. And so we already today bring this kind of option where you don't have to choose any one of our options for your entire practice or your health system. But as Dr. Proctor mentioned, we want to get that to the point where the doctor has the right to choose at every visit, every encounter. And one of the nice things about IKS is we have both the technical acumen and the operational acumen with our human workforce to be able to deliver on that. So it's a very complex problem, and we're excited to work on that as we move forward. But I think very few folks in the industry kind of have the ability to deliver that level of complexity when it comes to meeting clinicians where they're at.
Yeah, that is pretty interesting and unique. Well, I think everyone that watches these definitely wants to know where can they go to learn more, where can they get a demo so they can see this in action. So tell me, where can people go to learn more about your product?
Come and see us at IKSHealth.com. Reach out to us. You can reach Andrew and myself on LinkedIn. We're happy to talk with you and set up a demo.
Awesome. Well, Ben, Andrew, I appreciate you taking time to talk with us and share about the most exciting thing in health IT right now, the AI medical scribe space. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, guys.
Thank you.